Okay, I just had Zach read the passage, changing the way we look. I had him do a silent read, and so now I'm going to ask him to. All right, Zach, could you just tell me anything you can remember about the passage that you read?
Well, first of all, it's basically all about plastic surgery, and it's very expensive and very popular. It's facelifts are the most popular. It causes eye problems such as double vision, watery eyes, and another thing that plastic surgery does, or facelifts, it helps get rid of wrinkles, and ways to do that is dermabrasion and chemo peels. So, helps get rid of wrinkles. And another thing, which is one of the downsides of it all, is recovery takes a long, long time. That's it.
Okay, you did a good summary. I'm going to reflect onto my questions. I'm going to ask him some questions. If Zach happened to hit on just giving me the retell of something that I was going to ask, I'm going to mark the question with a UA for unaided. The other questions, if he did not already tell me, I'm going to mark it with an A, and then see if he's going to tell me the information on that. Okay. Describe what is done during dermabrasion.
Dermabrasion. Gets rid of wrinkles and the skin's rubbed away.
Okay. What evidence did the passage provide that the number of cosmetic surgery procedures done per year is on the rise?
What? Can you read it?
Yes. What evidence did the passage provide that the number of cosmetic surgery procedures done per year is on the rise?
Well, it's very popular, and that it's a growing business.
Okay. How is chemosurgery different from dermabrasion?
Well, chemo burns the skin, and dermabrasion just kind of rubs it away.
Okay. What are some of the possible complications associated with eyelid surgery? He actually did answer this question already, so I'm just going to have a UA already in that place. He doesn't have to answer that again. What are 3 considerations anyone considering cosmetic surgery should take into account before having it done?
Cost.
What are 3 considerations anyone considering to have cosmetic surgery should consider before having the procedure done?
Maybe expectations. Is that right?
That's right.
And I can't think of third.
Okay, that's good. What does the old folks saying suggest about cosmetic surgery? Remember the saying in there?
I think it's something like, if it's not broke, don't fix it.
Besides plastic surgeons, what other kinds of doctors can perform some types of cosmetic surgery?
Dermatologist, and there was some really long one that I couldn't pronounce. It began with no.
Okay, good. What does eyelid surgery sometimes why does eyelid surgery sometimes accompany a facelift?
Well, because it has to. It kind of has to.
Why does eyelid surgery sometimes accompany a facelift?
because it kind of has to distribute everything equally, so that way the eyes are different than kind of like, yeah.
Perfect. Okay, so now I'm going to go through and I'm going to mark because he answered the questions that he did. And what you're going to do with your student is you just try not to do a whole lot of marking in front of them because that can make them nervous. So you just try to make note of the questions that they got correct, the questions they didn't. If you do feel like you need a mark in front of them, try to do it a little bit more discreetly just to keep them calm, as it would make them nervous when you're marking in front of them. As you go into the next portion of the assessment, you can hand the passage back to them to read. And this time it's going to be a time test. If they're in the higher levels, if they're in the 10th, the 11th, or the 12th, the 10th, 11th, or the 12th level, what they're going to need to do is they're going to read the entire passage, and they're going to get a time of the whole passage. There's a formula set on this page. I need to password on that tells you that you're going to read they're going to read the entire passage, and then you're going to calculate the number of words divided by the length of time, the number of minutes, and that's going to give you the words per minute that it takes them to do, and then there's a scale for that. So now my student is going to read the entire passage again out loud to me while I time them. And so I will not stop, but while my student is reading, I'm going to use my miscue analysis page, this page, and I'm just going to make marks on any errors that they read. In a classroom setting, I might want to have a clipboard so they don't see my marks again, not to make them nervous. But I'm just going to make marks on any mispronunciations that they do over in the column. Okay? When you're ready, go ahead and begin.
Changing the way we look. Cosmetic surgery, once available only for rich and the famous, is a multi-million-dollar-a-year business in the United States. Rapid growth of this type of surgery has occurred even though patients must bear much of the cost. Because most cosmetic surgery is not covered by insurance, the cost is considerable, ranging from $1,000 to more than $10,000, depending on the procedure, the doctor who does the surgery, and the geographical location in which the procedure is done. Sometimes some types of surgery are done on the outpatient basis, while others require several days in the hospital that add to the cost of the procedure. Most cosmetic surgery is done to modify an individual's facial features for removal of fine wrinkle around the mouth, brow, eyes. Dermabrasion is often chosen. Dermabrasion requires the physician to use skill planning tools to literally sand off the wrinkled areas after first injecting them with local anesthetic. Smoother skin results, but the patient has to wait about 2 weeks for the now pinkened skin to return back to its original color.
I'm going to go ahead and have him stop. You did great. Just to show you that the only words that you're going to mark on miscue are going to be the first 100 words. So the first 100 words you would mark over here, and then after that you listen to your reader read up until the time's up, and then you'll follow the formula over on part 2 of your performance summary. Part 2 of your performance summary, then you'll be able to figure out the words per minute. He doesn't have to continue to do that because we'll just listen to him read to be able to figure out the words per minute. Yeah, you can go ahead and stop that. Based off of the silent reading comprehension, he fell into the easy category for comprehension. So at that point, I can go ahead and decide if I want to carry on to the next level and bring him up to the next level. I'm probably not going to because that's 11th grade. That's clearly going to, he's fine. He's at his, he's working above his level for my student, so I'm fine keeping him right here. For his words per minute, I would have to see how many words how long it took him. The number of words in this passage are 649. I would take 649 divided by the number of minutes that it took him to finish on my phone. And then from that, I would round to the nearest tenth. From the nearest tenth, I can figure out how many words per minute he's reading. There is a key to determine if he is reading fluently, below fluently, or above fluently for his level. And then on the miscue analysis, you can determine there was one word that was skipped that I was able to decipher. There was several self-corrects along the way. Self-corrects are not counted against him. There was just one omission. Based off of that, we can look over on the error analysis to determine if it was a meaning, a syntax, or a visual error, and where that takes him on his level. That's still working within his level of ability. And that is how we analyze the remaining assessments here. So thank you, and hope that was helpful.